So hi guys, it's Dr. Parth Palan here and welcome to the Last Minute Pearls, and today's subject is ObGy. So let's begin the video. Okay, so the first thing I want you to take a screenshot of is the indications of classic Cesarean section. This is often asked, you have to remember this. Take a screenshot guys. Next. And this, the intrauterine pressure in each and every event, like if the contractions are palpable, what's the pressure? Contractions are painful, what's the pressure? First stage, second stage. And this is the first thing. And this is the second thing, indications of early cord clamping. Okay, next. And this, infection related OBS is very important, because this they will usually ask you as a one-liner. They'll give a whole clinical case, and then in the end they'll ask you. So mostly you will just have to, and this you can't even use your logic, because here it's like very simple. What is the maximum risk? I mean, which organism has the maximum risk of transmission first trimester? There's no logic to it. You have to remember. So you have to remember this table. Otherwise, you won't be able to solve that question. Take a screenshot of this. Next is all the fistulas. What kinds of fistulas are common in what kind of situations? Take a screenshot. Next, the contraindications to tocoplysis. This is also the MCQ, the answer to one of the MCQs. So I just cut it and put it. Next. Then there is this mole, choriocarcinoma versus invasive mole. This is one of the most favorite questions, and usually many people, including me, were always confused, regarding what type of mole it is and how to classify a mole and what are the characteristics to be seen. So this almost concises everything related to a mole. Next, the villi, primary villi, secondary villi and tertiary villi, when they are formed and what exactly is the content. Next, the physiological changes in pregnancy. Like in pregnancy, this is related to the respiratory system. So in what is increased, tidal volume, IRC, minute ventilation. What is decreased, the residual volume and the total lung capacity. What is not changed is this, and this are the hormones. Similarly, in pregnancy, which are increased, which are decreased, and which have no change. Next, this is the color of the amniotic fluid in different scenarios. Like if it's golden, it's RH incompatibility. It's greenish yellow. I know it's, but you have to remember this. It's a little illogical because it's very difficult to differentiate between dark and dark brown. But this is what the one-liner is, and you have to remember this. A few one-liners they don't have much logic, but then we have to give this exam, so and we can't miss on the one-liners, because I have always considered one-liners to be very important and very scoring. Next, so I would really want you to remember all the tables of all the topics given in OBS basically. You read it from your notes, you read it from Datta, you read it from anywhere. But all the tables, and these tables are basically the plans of management. Like if this is there, then this is the management. If this is the management, because OBS is one topic where they will ask you maximum number of clinical scenarios, because they can't really give more of one-liners. They will try to make it a point that they give as many clinical questions as possible. So all the tables have to be very, very thorough. Then what I would like you to read is the BPH, drugs and doses. Then next, what you need to read is the VBAC criteria. Then next, other types of pelvis. It's on the right hand side page. There's a table in the top. You have to remember that table. Then there's constriction ring versus retraction ring. On the left hand side of the top, there is a table given, so that you need to remember. Then next, there's a chapter in Datta about fetal skull and pelvis. That also is a very important topic actually. So you have to remember that. What type of skull is it, and what are the diameter of the skull, all the other types of diameter of the skull and pelvis. That you have to remember. Then there is lung maturity tests. So this also is there in Datta. So the thing is, all these things are there in your notes as well. I'm just noting down most important topics and most volatile topics, which often we all tend to forget. Right? I mean, what I used to forget. So that's why I have to write it in my 20th notebook. And then for gynae we have semen analysis. It's always asked. It's a very simple thing to remember. It's always asked, so you have to remember this. And then you have the prolapse, the treatment of all the prolapse, because there's always one question asked from prolapse, and it's a very simple question because it's a very straightforward, like an old woman who cannot do surgery. It's very straightforward questions, but you have to remember prolapse and its treatment, all kinds of prolapse and their treatments. And obviously gynae, the most important thing obviously is the FIGO classification. So all types of cancers, all types of FIGO classifications, and all types of cancer treatments. This is the most important in gynae. So basically in surgery and gynae, you have to remember a few stagings of carcinomas, and FIGO classification of all the three, endometrial, cervical and ovarian, are very important with their treatment. So you have to remember this. So yeah, this was it from ObGy. Please try to remember this, guys. All the very best, guys. Kill it.